Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How to tell if you have intestinal worms in your stool. Intestinal worms, which live in the gut, are some of the world's most common parasites. Because they live in the gut, you can sometimes tell you have intestinal worms by looking at your stool. These parasitic worms are called helminths. /r/n/r/n. Seeing worms or eggs in your poop isn't the only way to tell if you have a parasitic infection. You may also have various digestive and non-digestive symptoms triggered by the worms or your body's reaction to them. /r/n/r/n/South_Agency, Getty Imagesrnrn Intestinal worms are most common in lower-income countries. The symptoms of intestinal worms may vary based on the worm. Often, people will have no symptoms of an intestinal worm infection. /r/n/r/n. Several types of intestinal worms can infect humans. The general term for these animals is helminths. Several helminths, such as the following, cause illnesses: :r/n/r/n. If you have an intestinal worm infection, you may be able to see worms or parts of worms, common with tapeworms in your stool. Eggs and larvae are harder to see. If you see something in your stool that looks like a worm, bring it to a healthcare provider for diagnosis. /r/n/r/n. The worms all look different. /r/n/r/n. You may have gastrointestinal (GI) symptoms that change the look of your stool, making it more watery, mucousy, or even bloody. For example, chronic schistosomiasis and heavy hookworm infections may lead to blood in the stool. /r/n/r/n. A severe whipworm infection can cause frequent, painful bowel movements of mucus, water, and blood. /r/n/r/n. Most intestinal worms do not cause symptoms if the infection is light. Gastrointestinal symptoms from heavier infections with intestinal worms can include the following: /r/n/r/n. While intestinal worms live in the gut and cause symptoms there are other symptoms to be aware of if you're worried you have these parasites. Some of the most common non-GI signs and symptoms of intestinal worms include the following: /r/n/r/n. Non-gastrointestinal symptoms that may show up with intestinal worm infections include the following: /r/n/r/n. Often, people who are otherwise healthy with mild infections and few worms are typically asymptomatic. They usually will not have symptoms of intestinal worms. /r/n/r/n. Common intestinal worm parasites that are often asymptomatic include /r/n/r/n. If you find intestinal worms in your poop, mention it to a healthcare provider. In healthy people, intestinal worms typically go away without treatment. /r/n/r/n. If you need treatment to deworm your body, most soil-transmitted helminth parasites respond to a single 400 mg (mg) dose of albendazole, or a 500 mg tablet of Vermox, albendazole. /r/n/r/n. Infections with strongyloidiasis respond well to strometol, ivermectin, treatment. /r/n/r/n. Pinworm infection is treated with Albenza Vermox, or Ascaral, pyrantelpamoate. All infested family members should take the drugs at the same time. It is given in 2 doses, the second dose 2 weeks after the first. /r/n/r/n. Intestinal schistosomiasis is treated with 1 to 2 days of prescription biltricide, praziquantel. /r/n/r/n. If you think you have intestinal worms, a healthcare provider will take a health history and review your hygiene and recent travel to endemic areas. /r/n/r/n. The only way to diagnose intestinal worm parasites is to see eggs, larvae, or adult worms in the stool or collect eggs from the perineum in the case of pinworms. /r/n/r/n. The fecal, stool, exam, also called an ovo and parasite test, detects the presence of intestinal worms and other gut parasites. For the test, you'll need to provide 3 or more stool samples collected on separate days. /r/n/r/n To collect the samples, you may need special containers with preservative fluid. If you don't use a special cup with fluid, keep the samples refrigerated but not frozen. /r/n/r/n Generally, when doing a stool sample test for intestinal worms, remember to /r/n/r/n Additional tests that may be used to diagnose intestinal worms or rule out other intestinal parasites include /r/n/r/n Instead of a stool test, confirmation of pinworms is usually done by finding eggs using a tape test or visualizing the female adult worm directly. Pinworms are rarely spotted in stool samples. /r/n/r/n To find a female worm, look around the anal area or in pajamas about 2 to 3 hours after falling asleep. If the worm is out, you'll see it with the naked eye. It is between 1/4 and 1/2 inch long. /r/n/r/n If you don't see the worm, you should do a tape test as soon as you wake up in the morning, before washing, bathing, going to the toilet, or getting dressed. /r/n/r/n Firmly press a piece of transparent tape against the folds of skin around the anus. The tape will pick up eggs or worms on the perineum. Repeat this for 3 days in a row. You'll need to seal the tape in a plastic bag and take it to your healthcare provider, who can have the lab look at it under a microscope. /r/n/r/n It's also possible that you could find pinworm eggs in samples taken from under the fingernails. /r/n/r/n Helminths live in the soil or the environment. They may pass through the skin or enter the intestines through something you eat or drink. They can even be breathed in. /r/n/r/n For example, hookworm eggs hatch in the soil and attach to bare feet and ankles. They penetrate the skin, migrate around the body, and end up in the intestine, where they attach to the lining and gorge on blood. /r/n/r/n Threadworms get into the body through the skin from contaminated soil, but their eggs hatch in the intestine. /r/n/r/n If you find yourself repeatedly getting infections with soil-based intestinal worms, there are some steps you can take to decrease your risk. /r/n/r/n Avoid eating raw or uncooked pork or beef. Tapeworms live in the flesh of cows and pigs. /r/n/r/n To decontaminate and avoid reinfection with pinworm during and after treatment, the entire household must take precautions to reduce the spread of the pinworm eggs. /r/n/r/n Pinworms can live up to 2 or 3 weeks at room temperature, so it's possible to be reinfected after deworming the entire house. Pinworms spread from the bare anal area to the hands or fingernails, then onto surfaces. They spread quickly when /r/n/r/n If pinworm reinfection continues, consider if other playmates, schoolmates, or close contacts outside the home may be reintroducing the eggs. Ensure everyone infected, even those outside the home, gets the 2-dose treatment and decontaminates their environment. /r/n/r/n Parasitic intestinal worms include roundworms, pinworms, hookworms, and tapeworms. These worms infect humans and can cause various illnesses. /r/n/r/n Symptoms range from gastrointestinal issues like diarrhea and abdominal pain to changes in stool appearance. You may also see parts of a worm in your stool or changes in stool appearance. Non-gastrointestinal symptoms of intestinal worms include rashes, respiratory problems, anemia, and malnutrition. /r/n/r/n Diagnosis involves stool sample testing to look for worms, eggs, or larvae. The healthcare professional may run other tests depending on the worm. Treatment includes medicines. /r/n/r/n Prevention strategies include maintaining hygiene, cooking food properly, and avoiding contaminated water sources. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.